Assalamu alaikum. My name's Nabiha, and I'm the secretary of the Muslim Doctors Association. Thank you so much for taking the time out to attend this webinar on a Saturday morning, and we hope you find this beneficial. Just a few things before we start. There will be an interactive element during the presentation, so if you have any comments, please put it in the chat box or raise your hand. And if throughout the presentations you have any questions that come to mind, please put the questions in the Q&A tab as a post, or you can raise your hand as well at the end of the presentations. And we're very honored to have Dr. Rafaqat Rashid from Al Balagh Academy joining us to answer all your questions. So now I'm going to pass it over to Dr. Zain Toukan, our health promotion lead.
Assalamu alaikum, everyone. Thank you, Nabiha. I'm Dr. Toukan, the Health Promotion Lead for Muslim Doctors Association. And I'm going to start. Okay. Can everyone see the slides? If you can answer in the chat. Okay. All right, so what we'll be covering today is getting the most out of Ramadan for our physical and spiritual health. I'm going to be highlighting a few important things about maintaining a healthy diet in Ramadan to gain the maximum benefits and some safe exercise strategies in Ramadan. Okay. So we're going to be talking about the fasting body, the physiological changes, the Ramadan rewards, so the health benefits of fasting, the physical health points of staying fit and energetic during Ramadan, maintaining our mental well-being and our social well-being, and how to have a spiritual vitality in Ramadan. So what happens to our body when we are fasting? So when we are fasting, the medical definition of fasting is not eating or drinking for more than 8 hours. The main source of energy in our bodies is carbohydrates. And carbohydrates are stored in the muscles and the liver and broken down into glucose. When we are fasting, we start burning up, we use up the glucose, and then the body starts to tap into the fat stores. If we fast for longer, beyond days, then protein starts to get consumed. When we're also fasting, the body conserves water, so there's a hormone that is produced to reduce the production of water, so we don't get dehydrated when we're fasting. So some of the benefits of fasting. So fasting can lead to a healthy weight loss. Again, if we follow a healthy diet. There is some evidence that fasting improves our immunity. So the fasting body, it increases the production of antibodies and white blood cells, some of the cells that are helpful in fighting infections. It also reduces chronic inflammation and oxidative stress. Fasting also helps us control binge eating, so that promotes healthy weight loss, and it's a nudge for a lot of people to stop smoking. There's also some evidence that it improves blood sugar control, so the blood sugar doesn't fluctuate during the day, and improves blood pressure control and cholesterol control. Again, if we follow the right diet, it can give our bowels a rest, and so improves gut digestion. It may sound surprising that fasting also helps improve our cognition. In Ramadan, we've got this shift in our sleeping and eating patterns. So it means that our brain is working stronger to set to this new chronobiological pattern, and that helps produce brain growth factors, and thus leading to improved cognition. Fasting brain also increases serotonin production, which is one of the happy hormones. So it boosts mood and reduces anxiety and depression. Also, when we are fasting, we're in the month of Ramadan, there is increase in Tarawih prayers and Tahajjud prayers, which are the Muslim equivalent to meditation and mindfulness, which we know are now mainstream recommendations for improving mental well-being, helping in anxiety and depression. Also, when we are fasting, it's a time for gratitude, contemplation, and compassion, and we know that these three things improve our mental well-being. Ramadan is also a time for us to improve our social well-being, fostering community bonds. So it's a time when there are a lot of community iftars getting together. It's also a time for peace and tranquility. So in Ramadan, we're not only holding our fasting food and in intimate relations, but also we're holding our tongue, which also leads to improved community well-being and community bonds. And also it's a time for us to give charity, which improves our community bonds. It's a time to help our spiritual vitality as well and enhancing our inner peace. It's a time to reset connection with the Almighty and Islamic teachings, so to lead this God's consciousness. And it's a time for us to self-regulate, holding our tongue and our mind, and increasing our soul, so purifying the soul. It's time for us to reflect, to figure out our purpose, our productivity, and increasing our blessings, our knowledge and action. Again, going back to the point of holding our tongue and improving our character and manners. So to have a healthy Ramadan, one of the important things is having eating a balanced diet. So a balanced diet including all of the food groups, the carbohydrates, protein, fats, dairy, fruits, and vegetables. Choosing local and seasonal produce so that everything is fresh if that's possible, and having whole foods over processed foods, which include a lot of preservatives and additives. Focus on complex carbohydrates like oats, quinoa, wheat, and barley that lead to lasting fullness. Foods to avoid in Ramadan: so avoid deep fried foods, oily foods like samosas and pakoras, because they slow down digestion. Limit high sugar treats, sugars gola dumun, because they can lead to our blood sugar fluctuating during the day. Cut back on high fat items, again, that impairs digestion, and reduce salt intake. You can add a bit of herbs and spices, but again, not too much to avoid getting thirsty during the day. Steer away of refined carbs, so white flour and processed foods and greasy pastries. And again, it can lead to slowing digestion. And so it's having that balanced diet, so of eating all of the food groups, again, including fruits and vegetables, the carbohydrates and breads, cereals, having milk and dairy, and proteins and pulses and food and drinks, which takes me to, it's very important to keep well hydrated during Ramadan by drinking at least 2 liters of fluid during the day. Make sure it's water and sugar-free fluids. Try to skip caffeine if possible. Caffeine is a diuretic, so it promotes water loss. Choose unsweetened herbal teas. Avoid sugary beverages like fruit juices, and eat water-rich foods like fruits, vegetables, particular cucumber, soups, and yogurt. Now, when it comes to iftar, hydrate first to prevent overindulgence. Energize with a light starter like soup or dates. Dates are high in potassium, so they also help with muscle and nerve function. Be careful of not consuming too many because they are also high in sugar. And enjoy a wholesome meal, again, of that full balanced diet. Include fruit, vegetables, grains, and proteins. At suhoor, try, again, never to skip suhoor so you get the sustained energy during the day. Choose a balanced, light suhoor meal to include all of the food groups, and opt for fluid-rich foods so that you stay hydrated during the day. Drink plenty at suhoor. Include slow-release carbohydrates, and say whole grains, oats, and quinoa. Add high-quality proteins like yogurt and eggs, and to stay full for longer, and include healthy fats like avocados, nuts, and seeds. And in Ramadan, so use healthy cooking methods, cooking, and baking, steaming, and boiling over frying. If you have to fry stuff, try to shallow fry. Again, if you're a sweet tooth, opt for milk-based desserts, malai and barfi, instead of high sugar sweets, and bake homemade pastries instead of buying the pre-made options, which include a lot of preservatives and additives. I get asked, is it safe to exercise in Ramadan? Seek advice from your health and fitness professional, your personal trainer if needed, and tailor your workout to your own fitness level because fasting can impact health. Maintain or reduce your current exercise intensity during the 4 weeks, and opt for light activities like walking, stretching, or yoga. Include light weightlifting to preserve muscle mass, and avoid heavy exercise while fasting to prevent fatigue and dehydration. Now, in terms of the timing for exercise, so there's some evidence to suggest that a pre-suhoor session for having a cardiovascular workout may optimize fat loss. Again, timing is related to your energy levels. Some people say after suhoor. Again, it is the start of the day. You've replenished your energy, but there is a risk of you getting dehydrated. Before iftar, and because we know that there's an opportunity to replenish the food, the energy that we lost while exercising, just a couple of hours later, still say opt for lighter activity. And after iftar is the best time for workouts, but avoid doing it right before sleep because that can lead to an adrenaline spike, and that can then affect the quality of your sleep. An evening walk is ideal post iftar because it can also help with digestion. Now, in terms of sleep, so it is tricky during Ramadan because of the late night prayers and waking up earlier for suhoor. Larger blocks of sleep are better than short naps. Try having, when we say consolidated sleep, at getting 4 hours of sleep after iftar before waking up for suhoor and fajr, and then returning to sleep for a couple of hours after before you have to get up for work. If needed, consider having a short nap, a power nap of 20 to 30 minutes after work or lunch if needed. Make sure to set an alarm so that you don't sleep for longer. Strive for consistent sleeping patterns. The body thrives on routine, so trying to get to bed at the same time every night and waking up at the same time. Again, being mindful of the diet, so reducing caffeine intake, hard to digest foods, which can impact our sleep, and creating a quiet, cool, and dark sleep environment. Now, after Ramadan, gradually return to your regular sleeping habits. So if you were sleeping at 2 a.m. in Ramadan, try going back 30 minutes until you go back to your regular sleeping pattern pre-Ramadan. Now, when it comes to medical conditions and fasting, check with your GP. If you have a chronic health conditions or are taking medications, it is permissible for certain people not to fast during Ramadan. Certain health risks may exempt you from fasting. Avoid fasting if an insulin. Sister Nabiha is going to go in depth about certain medications and fasting in her presentation. If you are a type 2 diabetic and you decide to fast, then make sure you increase your home glucose monitoring. If you feel unwell, you've got severe abdominal pain, feeling dizzy, start to vomit, then break your fast and seek medical advice. For pregnant women, Islam allows you to opt out of fasting if you fear that fasting will harm the health of your baby. Most experts agree that it's not safe to fast while pregnant. However, fasting is a personal choice. And if you are pregnant and choose to fast, make sure you keep well hydrated, drink plenty of fluids, eat, again, a hydrating food, a well-balanced diet to have these slow-released fibers again, and continue on your prenatal supplements like folic acid and vitamin D. So in conclusion, Ramadan boosts our spiritual, physical, psychological, and social well-being. You just need to be mindful of our eating, how much we drink, having adequate sleep, and staying active and fit. Consult your health professional if you have medical concerns or are pregnant, and embrace gratitude, prayer, charity, and community work and self-discipline for our mental wellness. Thank you very much. And I am going to pass Nabiha.
Assalamu alaikum. Can everyone see my screen? So that's great. So today I'll be discussing the knowledge of the Islamic rulings related to fasting, particularly focusing on medication. So we'll try and make the session as interactive as possible. So in this session, we want to identify the categories of individuals who are exempt from fasting according to Islamic law and explain the underlying principles. We also want to explore the specific processes and criteria that leads to the invalidation of a fast with a focus on contemporary medical perspectives. And we also want to discuss the impact of various medications on the validity of fasting and the pharmacological reasons behind these effects. So who can fast and why? So the Sharia states four particular issues to help navigate how to deal with people that are fasting and when they become exempt. So the first one is if physical conditions worsen when fasting. For example, if you're regularly working in a warm climate, you can argue and say that the physical condition worsens. But at what stage would you say that they're exempt? And the other consideration is slower recovery. So, for example, if you had a chest infection and you had to fast, and if you're feeling weak, then the recovery is slowed down. And if you had a common cold, which may affect the recovery, at what stage would you say that a person is exempt from fasting? And also worsening medical condition. So it means that their symptoms, for example, if feeling low, what does that mean? We can all go through stages in our life where we feel low. So when do you decide whether the mental threshold is severe? And then we have pain as well. So worsening pain is another example. For example, someone that has severe lower back pain, that can be quite subjective as well. So the main thing is how it's affecting that individual. So I'm just going to give some examples of scenarios. So it'd be great if the audience could give some thoughts on them, whether these people would be exempt from fasting. So the first one is a patient who suffers with asthma. So do we have any thoughts? Does anyone want to put a comment in the chat box or raise their hand? So we're looking at a patient with asthma, just based on these principles. Does anyone have any ideas? Yeah, so we've got, I think it'd be exempt if could be life-threatening, not taking medication. Yeah. So really the asthma has to be severe enough to be excused. So it really is case by case, on a case by case basis, dependent on how well controlled the condition is, in order to make that decision as well. What about a frail elderly woman? We've got more if they need an inhaler often, yeah. So it really depends, and we can explore that more um, later in the Q&A if you have any specific questions around that. Um, and what about a frail elderly woman? So with the frail elderly woman, it depends on yeah, so it depends on what degree she's frail. So is she unable to perform day-to-day activities? Yeah, so that's a good point. Like if there's any falling or confusions, the main thing is how it's affecting her. Yeah, and if the condition worsens as well, so if it's impacting her, she can't do any day-to-day activities as well. That's also a factor. What about a young man in severe back pain? So we've got someone who's in a lot of pain. Yeah, again, it depends how severe enough. Can they do simple activities, like getting out of bed to use the bathroom? Like if they can't get out of bed to use the bathroom, then they would be exempt. So it really depends on how severe the condition is. Um, and what about a woman who has recently, yeah, and painkillers as well. What about a woman recently delivered and suffering from depression? So the depression also has to be severe. So if she can't do normal chores, then she's excused. And also one needs to also consider if someone has a curving desire to eat, um, and it can also exacerbate symptoms and make things worse. Um, and it really depends on the case when it comes to that one. And what about the final, the second to last, a young man sitting GCSE exams? What do we think about that? Yes, correct. So there's no clear evidence that someone who fasts affects grades. So people might feel tired anyway, due to lack of sleep, not the fasting itself. And the final scenario, what about a diabetic patient on insulin? Yeah, so they are exempt, but it also depends as well how severe the condition is. So if the diabetes is not well controlled, then they are at risk. They are excused, but otherwise, if they can do it safely, um, then they can fast. And I'll talk about diabetes later as well. So not all of us have the same level of spiritual motivation to fast. So it's based on a personal decision, depending on how much fasting is a priority. There's also what the religion stipulates, as well as the medical opinions. So we have to take a lot of things into consideration. So I'm not going to go into too much detail about chronic conditions, but this is just an example of diabetes. So it just gives an idea of who would and who wouldn't be exempt. So, for example, if blood sugars are extremely high, that you become acidotic and sugars are extremely high, then you would be exempt. So certain cases you can do a trial fast, and then if you're feeling unwell, then you would be exempt from fasting. So it really depends. And British Islamic Medical Association, they've produced a Ramadan compendium. So has details on other comorbidities and conditions. For example, asthma, COPD, bronchitis, depression, chronic heart disease, and chronic renal disease. So there's a really detailed guide on that from the organization as well. So that this is just a summary of diabetes, and there's more depth if you look into that, and the references will be at the end as well. You can have a look. So what invalidates the fast and why? So there have to be five criteria that all have to be met for the fast to be invalidated. So there has to be a discernible, visible substance. So it's called a qualified agent, for example, food or drink, or any edible or non-edible substance, liquid or solid. Air doesn't invalidate as it's natural, as well as extreme temperatures. So the substance has to reach the digestive system, which is a qualified cavity. So that's the stomach, throat, and the intestines. So anything that enters this invalidates the fast. So the substance needs to enter from an entry point connected to the digestive system. So this doesn't include the ear, the pores of the skin, or the lacrimal duct of the eye. And the substance has to stay there, like has an independent stay, for example, inserting a suppository. And there's also has to be no excuse present. So absolving states, such as if a person forgets their fasting, they would be exempt in that situation as well. So this is just an overview on what invalidates the fasting related to the throat. So the Shari throat is the Sharia understanding of the throat. So a substance has to pass this in order to invalidate the fast. So the Shari throat is the middle throat to the bottom end of the throat. So the substance has to pass this point, which has the direct flow into the stomach. So the Shari throat ends at the bottom of the throat. So that's below the blue area, which is the epiglottis, which basically closes over the windpipe. So the substance can be edible, non-edible, have nutritional, non-nutritional value. It can be solid, liquid, or gas, and it needs to be visible. So, for example, a white fume or smoke. So, if you have an intention, for example, that something will pass the throat and it does, then it will invalidate. So, if you know the substance needs to, for example, reach the lungs, then you know it will pass the throat in order to reach the lungs. And there has to be a clear passage, not just the fact the substance is being absorbed through bodily fluids and reaching the cavity as well. So, substance needs to establish itself in the qualified cavity independently or disappear from view. So any kind of remnants that remain in the qualified cavity after withdrawal will invalidate the fast. So finally, one is excused if one eats food forgetfully or there's an unintentional hardship in avoiding the substance to pass the throat. For example, negligible water passing the throat when gargling. So that's you know that's one's excused for that. So we're going to get into the details, the specific medications now. So based on what we've discussed, do we have any thoughts um, about this? the whether the eye drops, nasal sprays, and ear drops invalidate the fast. Yeah, so in the eye drops, no, yeah. So with the nasal area, if you were to use a nasal spray, you would reach the back of the throat, but not the shari throat. So there's specific area of the throat which invalidates the fast. So if you spray the nasal spray far enough and you can clearly feel like it's going down the throat, then it would invalidate the fast. Otherwise, it won't. So it's just like if you're doing it in a way where you're clearly spraying it um, down the back of the throat. So for the eyes, the lacrimal duct falls within the sinus. So if you taste eye drops in the back of the throat, it doesn't invalidate the fast because it doesn't pass down the shari throat. So that's really the main kind of principle here is whether it passes down that specific part of the throat. Um, with the ears, there is that passage to the throat, but that requires a rupture of the eardrum. So if the eardrops, if they land on the throat and it doesn't surpass the shari throat, then it doesn't invalidate the fast. So there's a risk with dental procedures. You might swallow liquid, and hence it's disliked. There's also chewing gum. So if you're chewing gum which is flavored, it's disliked. If you're chewing sweets in the mouth and you keep it at the front part, the flavoring's going into the saliva. So that will invalidate the fast. So what about inhalers? Yeah. So with inhalers, if the aerosol, yeah, so if the aerosol procedures, if they reach or pass the throat, then it will invalidate the fast. So inhalers, if the vapor of the inhaler is visible, so like we mentioned before about the criteria, so you can see the white mist, it enters the gullet, so that's connecting the mouth to the stomach. Then you have to make up the fast. Um, but I will mention that some scholars look at this in the form of perspective of quantity of medicine. So if there's a small percentage going down the throat, then it's acceptable. There's also steam humidifier. So the water is present, so that does, but not Vicks, because it's not visible. So it has to be visible. Perfumes won't, but if you inhale it intentionally, it can invalidate the fast. Bleeding. So if you bleed in your mouth and you're swallowing saliva, if the saliva is such that the majority saliva is blood, then this potentially invalidates the fast, but it doesn't apply to mucus as well. So if you produce vomit and swallow it, then it will invalidate the fast. It will break the fast. Gastroscopy. So that will invalidate the fast due to gel remnants which remain in the cavity. Um, Dry swabbing or biopsy won't invalidate the fast as it can be withdrawn. So this is the what we've covered today. And does anyone have any questions they want to put on the Q&A chat? So Dr. Rafaqat Rashid will be joining us soon. So just bear with me just a few minutes while he comes online. In the meantime, if you've got any questions you have for him, if you want to put it in the Q&A box, anything from what we've discussed, anything you're unsure on or not clear on, please put it in the Q&A box.
Hello, can you hear me?
Yes, Assalamu alaikum.
Alaikum salam wa rahmatullah.
Assalamu alaikum. Thank you for joining us. Um, yeah. So we had some questions about then just a couple of things. So I'll just go through them just one by one, if that's okay.
Yeah, no problem, inshallah. Bismillah.
So the first question was about intramuscular injections and whether that's okay.
Okay, so any kind of intramuscular injection or any kind of injection, it could be even intra-articular. It doesn't necessarily have to be intramuscular. The fuqaha have made it very clear that the channel in which it receives or it reaches the main cavity, that has to be patent. So if it's anything in sense, which is related to soft tissue, muscle, or anything like that, would not be considered as a patent passage, which leads to a cavity. For that reason, any approach that we use in terms of giving any kind of medication through these routes would not invalidate the fast. And that is generally the general consensus of all the different schools.
Okay, thank you. Thank you very much. The other question was about antipsychotic medication for long-term conditions.
Okay, so taking antipsychotic medication, there's no problem with that anyway, generally, as long as it's appropriate for that particular patient to be taking such medication on the advice of their doctor. But during Ramadan, I'm assuming that this medication is usually taken once a day or twice a day. So from the medical perspective, they could take it generally the same time every day, during suhoor, maybe, or iftar, maybe at those particular times. But if they are taking medication which requires them to take it generally through the day, which I'm not really familiar with any particular medication that you'd have to take quite a few times in the day, which would basically be in day hours. So maybe possibly a beta blocker if you've got severe anxiety. So somebody may be on propranolol, for example, and they're taking this, I don't know, 3 times a day. So they would take it at suhoor, they'll take it at iftari, and then there's an expectation that they take it during the day. What they would need to do is initially do a trial fast without taking that particular medication during the day, and see how they are. And if they find that they're okay and they're able to cope, then that's the way they should go. If it so happens that they are in a Ramadan itself, and this is the time where they can't really trial fast, what they're really doing is they're just fasting, then they should fast. They fast, and then they see how the day goes on. And if they find that they're struggling to cope, then they're excused. Now the question arises here: struggling to cope. What does that actually mean? And that, in essence, means that they're in such a state they are not able to carry on performing their core daily activities, which are an important part of their general well-being. So that means they're not able to get to the bathroom. They're struggling. They can't. They're unable to sort of prepare food for themselves, to eat appropriately. Those activities are which are considered as important daily activities. They're not able to perform them, i.e. they're bedridden, they're not able to get out, they're stuck in a little corner in the room because they're suffering from extreme anxiety. So those would be excused. So there are quite stringent conditions in when you are excused.
Okay, thank you for the detailed in-depth answer. I hope that answers the question. And then we have another question on someone who's on dialysis and whether they can fast.
Okay, so dialysis is a bit more of a tricky question. Because when we talk about dialysis, we're talking about either hemodialysis or peritoneal dialysis. So in either case, you will find that there is scholarly difference of opinion on this. And the scholarly difference of opinion is on the basis that is the vascular system considered as a qualified cavity or not. So you'll find a lot of scholars say it's not. So therefore, you can have blood transfusion, you can have IV fluids, etc., and it would not invalidate the fast. Now, I've done quite a bit of recent research in this area, and my understanding in this is it does invalidate the fast. So on the basis of that, that the vascular system does qualify as a qualified cavity, because at the end of the day, when we're looking at the gastrointestinal tract, and we're absorbing all sorts of nutrients through this tract, it's going through the vascular system. That's where it's headed, and that is the asal. That's the source of where all this is going. So on the basis of this, and I elaborately sort of talk about this in quite a lot of detail. I can see there's a link there to one of my articles. If you look at the one which relates to cavities, you'll find a lot more information in there. So in that understanding, any kind of hemodialysis would invalidate the fast, and any kind of peritoneal dialysis would also do the same, because there is a cavity there, and again it goes into the vascular system, it's absorbed there, and hence it would also do the same. So from my perspective, it does invalidate, but you will find there are certain scholars who would basically excuse you on that and say, it would not invalidate your fast. So there is a difference of opinion there.
Okay, thank you. And then we've got a scenario-based question. So a woman that is pregnant for 5 months, she's had thyroid and thalassemia and recently had smallpox, and the partner also has beta thalassemia. So if she fasts, would that harm the baby? And is she exempt in that situation?
Okay, so I'm assuming that her thalassemia is a trait thalassemia, and it's not clearly a problematic condition that she has where she needs, blood transfusion and things like that. And also, if she's got a thyroid condition, it's controlled. And if that's the case, and she's feeling healthy and she's feeling well, then so there's a medical sort of response to that, and there's a Islamic response to that. So a medical response, would probably be that, in that situation, she should not fast because, she's got all these sort of medical conditions. And from the medical perspective, we tend to be, quite stringent on this idea that you don't fast. There's a great inclination towards that. That's why the fiqh literature states that you must go to a tabib al-hadiq, who is a Muslim. And the fuqaha are quite specific about that. And the reason why they say that is because it needs to be somebody who's clearly an expert in the area, who can advise you appropriately from the medical perspective. And not only that, but it must be a Muslim who understands the sentiments of fasting and the importance of fasting, and hence would be, somebody who would not excuse anyone just on the basis of a minor illness. So on the basis of this, from the Shia perspective, again, the same issue arises. Trial fasting. You should try trial fasting before Ramadan initially, just see how you feel, and if you feel that you're feeling well through the fast, then continue fasting. Even if you were to fast during Ramadan, and you felt very weak in one of those days that you fasted, or during a couple of days, then you can break the fast. Clearly, if you're compromised, so you can break the fast. You just make up for that fast later on. You just do a qada. There's no kafara. Kafara is where you would have to compensate with fasting over 2 months continuously. So you wouldn't have to do that. You just make up for that particular day that you missed, and you just continue through the day. You eat and drink the least amount that you can to feel good or feel better, and then just continue the next day. And if you find that it's a continuous thing, then it's probably best to advise that you don't fast in that situation.
Okay, thank you. So the next one is about breastfeeding women and whether they're exempt.
Okay, so yeah, breastfeeding women, usually the issue arises more so when we're looking at long day fast. So, you know, in the UK, the winter, the summer months, if when Ramadan was during the summer months, that would be a lot more problematic because that could cause, you know, some element of dehydration in these women, and clearly the milk production would be reduced quite considerably as a result of that, and then hence, you know, the baby would suffer because they're not getting enough milk. But during short period fasts, you know, where you're in those sort of times, as long as you're well hydrated, it should not have an immense impact on your lactation in producing milk. So you know, you can fast. If, and again, same thing again, the trial fast, try the trial fast. You know, you fast, see how you are, see if you're producing enough milk, and if you find that your milk production is reduced quite considerably and it's affecting the baby in terms of their feed, then you would be exempt in that situation.
Okay. And just to follow up, well, another question, is it okay for women to take pills to delay their menses during Ramadan?
Okay, so that's an interesting question. Okay, so it all depends on who you approach. So if you approach certain ulama who have a problem with taking pill, and what I mean by that, they don't consider it haram, but they feel that you're playing around with your normal hormonal sort of status or cyclical changes, so they don't like the idea. They can't say it's haram. You know, that's clearly the situation. Hence, what they normally do is, if these are the same ulama who would say that if you were to go on Hajj, for example, that you should not take the pill and you should follow the rulings related to menstruating women. But the general issue here is that we know that taking the pill is quite safe, yeah, as long as it sort of fulfills certain criteria, i.e., the health of the woman, etc. So the safety element is not being questioned here, yeah, especially if it's over a short period of time. The question here arises is that clearly this particular individual wants to fast during the month of Ramadan, and she's going to have a period in there where she's going to be menstruating, and hence, you know, she would not be fasting during that time. Now, we're taking into consideration that you cannot fast when you are on periods. You'll have some people who would argue that case, but that's a separate discussion altogether. Let's say, so if you were menstruating, you cannot fast, and hence what they would do is they would make up for that particular day that they've missed. If they were to take the pill and through the whole month and they were fasting, then those fasts are valid. There's no problem with them. It would be advisable that you follow the spirit of Islam and recognize that Islam has rulings that cater for women who menstruate during Ramadan, where they just do qada of those days that they've missed, and just follow that general stream. If you decide not to, and you decide to take the pill through the month of Ramadan, then there is no issue with that. Some ulama may say that it's disliked, but they can't say that it invalidates the fast, nor can they say that it causes any issues with your fast in its validity in any form or manner. So the end answer to that is it is permissible, but it's better not to. Yeah, and the better not to is not stringent. Hopefully that answers the question.
Thank you. Do we have any more questions?
Yeah, there's one in the chat. If someone has a miscarriage and then bleeding after, is that najis? And if not, then can they fast?
Okay, so if you are having postpartum bleeding, so we call that nifas from a Sharia term, and postpartum bleeding clearly would be a state just like menstruation, like haid. So you are expected not to fast. You're not supposed to fast during that particular period. Then you follow the rulings related to nifas, which is about approximately 40 days, if the bleeding persists through the time. So yeah. So the idea is that you don't fast during that particular period, and then you just make up for those days later on.
Okay, thank you. So we have just another question about suppositories, anal suppositories, whether they invalidate the fast.
Yeah, so yeah, suppositories in essence are, their role is to provide medication to you, either locally, which is usually the case, or even systemically. Yeah, so from that particular perspective, they are placed at the bottom end of the gastrointestinal tract. So you have an area which is basically the rectum, and if you look at the rectum anatomically, you'll find that the upper part, the upper end of the rectum, is an area which is vascularized, which is considered as the gastrointestinal tract, and then the bottom end is clearly an area which isn't. So from that particular perspective, suppositories are intended to go deep enough to be in the area where there is a clear mucosal lining. So that would, in essence, be considered as entering a cavity. So inserting a suppository deep enough would actually invalidate the fast. That is a recognized opinion amongst the majority of the schools. There are a few odd people who would differ with that, but the general majority would say that it would invalidate the fast.
Doctor, I've got, so if someone has a PEG, then does that invalidate the fast because it's entering into cavity directly, whether it's medication or food given through the PEG?
PEG feed, yes.
Yeah.
PEG feed is basically an entry point from external directly into the stomach, into the gastric sort of area. So it's a direct access through a patent passage into the what we call the Jawf al-Mu'tabar, which is the qualified cavity. So that would invalidate the fast, yes. Anything that you pass through that would invalidate the fast, be it medicine or food, drink, or anything.
And we just had another one on vaginal examinations and whether that invalidates it.
Okay, so a good question. In the classical kitabs of fiqh, you will find that it says very explicitly that it would invalidate the fast. But then if you go into the detail, you realize that that was with the understanding that the vaginal cavity was actually attached, or there was a link or a connection between that and the gastrointestinal tract. That was the understanding at the time. We know that that's not the case. So in that particular instance, you will find that the opinion on that now is that any kind of examination or inserting pessaries or anything like that there would not invalidate the fast. Okay, that's the important thing to take from there. However, when it comes to ablution, that wouldn't be the case either. So in essence, the main point here is it related to fasting. So yes, the answer there is it would not invalidate your fast. Having said that, clearly you understand through the explicit text of the Quran that sexual intercourse would invalidate the fast.
We've got a question from the audience. Sulaiman?
Yes, assalamu alaikum wa rahmatullahi wa barakatuhu.
Wa alaikum salam wa rahmatullah.
Jazakallah khairan for the program. Yes, we know that we are allowed to wash the mouth when we are making wudu with water.
Yes.
But, I feel that it's really very difficult to see that all the water you put in your mouth, it will be out. So, I mean, there's no that risk of the water reaching that throat area, which the lady mentioned before as we started with the program.
Yes.
Are we exempt from whatever has gone now, is beyond our control as it is, or what do we do with that water? Or should we put just a little bit just on the lip without washing the mouth, or what exactly what amount of water we're allowed to use in terms of wudu?
Okay, so a good question. So you will find that the fuqaha make this very clear, and they say that number one, that when you rinse out your mouth, and you're doing this as part of your ritual, as part of your ablution, your wudu, and even if you're doing it as ghusl, then you can do that. There's no problem with that. Okay, but you do it in such a way that it doesn't go as far back as your throat, and you don't swallow the water. Now, if there is, and clearly in every chance that you will swallow small amounts of water that will pass through, which you have no control over, that's considered as udhr. In other words, it's excused because of arduousness, hardship. Okay, and you can't control that. So that is excused. But the most important thing here is the condition of niyyah, your intention. Your intention is not that you swallow the water. Your intention is that you are just rinsing your mouth. Okay. Now, if you have the intention that you intend to take it past your throat, i.e. the water, then that would invalidate the fast. Okay, so that's the difference. The intention is the pivotal condition here. Okay, clearly this is just qata'a. It's basically just a mistake that you made, and it's just passed through. If it's done accidentally, so let's say you had water in your mouth, and you were rinsing your mouth out, and you swallowed a large amount of water, that would invalidate the fast. And that's not with intention, because even then it's a situation, but that's a large amount of water that you're swallowing, and it was done accidentally. So that would actually invalidate the fast. But actually just rinsing your mouth out with water. So let me give you an example. Miswak, using a miswak contains many different types of ingredients, and we brush our teeth, and miswak is encouraged during Ramadan, yeah, and it's considered an act of worship. So with miswak, not only are you very small amounts of probably of those ingredients are passing through your throat, but the intention is not that you're swallowing them. Yeah. So there are two elements here. The first is the quantity, yeah, and also the intention. Okay. As long as the quantity is very little, and it's arduous, i.e., it's hardship to maintain that, and the intention is for it not to go past your throat, then you will not invalidate your fast. If it's contrary to them too, then you would. Hopefully that answers the question. It is a bit of a tricky question, but that's the general answer.
Okay, thank you. Because you brought the issue of the miswak, now it comes again, sometimes people ask about the toothpaste
Yes.
during the fasting. How can we advise our patients?
So toothpaste will not invalidate your fast because number one, the intention is not for it to pass your throat, okay, and that has to be clear. And the other thing is that the quantity, if it does pass your throat, would be very minimal, if at all. However, toothpaste is heavily discouraged, and in fact, many of the scholars say it's makruh. Yeah, it's disliked that you use toothpaste. It won't invalidate your fast, but it's disliked, and the reason why it's disliked is because it's flavored. Toothpaste is flavored, and that's where it becomes problematic. And placing anything that's flavored into your mouth is an issue. No problem, inshallah.
Thanks. We've got another one about if someone needs a drip, does that invalidate the fast?
Okay, so I answered this question earlier on, and I, in response to the question of dialysis. So yeah, the vascular system, in essence, is by a lot of ulama considered as not a jawful mu'tabar, a cavity, a qualified cavity, which will invalidate the fast. For that reason, you'll find that many scholars say that it would not invalidate the fast if it goes directly into the venous system, so i.e. having IV fluids, etc., that kind of thing. But my recent research has demonstrated that it does invalidate the fast, because I've demonstrated through the principles of the fuqaha that it is actually a cavity. It may not look like a cavity, like you find the gastric sort of tract, but it is a cavity in itself, because that's where the sources of all the nutrients go. So for that from that particular perspective, and you can see the link here, you can read the article yourself and read it in detail. And in fact, I'm in the process this Ramadan to actually put out an article which is intended to go to a number of ulama, both in Arabic and in Urdu as well as English, to a number of senior ulama, and then get their understanding on this point. But generally speaking, the main point here is that, from my understanding, it does invalidate. So using IV fluids or any kind of medication that you're taking via IV intravenously would actually invalidate your fast.
As a follow-up, someone's asked, how about giving blood or having blood tests done?
Okay, so blood is the same, because what you're doing there is clearly you're giving blood, and you're passing that through intravenously. Yeah, so blood would do the same. It would invalidate the fast. Taking bloods is different, because you're not actually putting something into your cavity. You're actually withdrawing something from the cavity, i.e. your blood. So you're withdrawing blood from your veins. On the basis of that would not invalidate your fast. It is discouraged by ulama to actually have your bloods taken, and I know that can be very problematic, especially if you're running a general practice and you're having to get bloods from Muslim patients who are fasting. It's discouraged because the fact that it may cause weakness in patients. Now, it doesn't cause weakness because of the amount of blood that you've taken from them, because it's a very small amount, but rather the weakness is more so the fact that the feeling, or it's probably more the psychological impact of how we're having a blood taken, that it actually makes them feel quite weak, and they may be pushed into breaking their fast because of it. And that's why they discourage it. But generally speaking, from a ruling perspective, it does not invalidate your fast if you have your bloods taken.
Thank you. And how about donating blood? As if it's more likely to cause weakness, so then is it not encouraged in Ramadan to donate blood?
Yeah, so I would not encourage anybody to donate blood during fasting. Not because it's going to invalidate your fast, but it may lead to you invalidating your fast because you feel weak. And anybody who's going to have a blood test, they normally encourage you to have a cup of tea or something like that immediately after it, because of that sense of weakness. So for this reason, it would be highly discouraged to donate blood.
Thank you. Do we have any more questions from the audience? Okay, so that's it. Thank you so much for taking the time out to answer the questions. And if there's anything you want to ask, anything more, the articles and the references are there. And we've also got our email addresses as well. If you want to ask any more further questions you think of after the webinar. Jazakallah khairan, and may you all have healthy, peaceful and blessed Ramadan.